Okay, so my name is Joanna and I'm going to be a registered dietitian, and today I'm going to conduct your nutrition focused physical examination. Your name is Teresa and you're here to be assessed for malnutrition. So to start, your blood pressure today was 116/78, which is good because a normal range is 120/180. Your respiratory rate was listed as 16 breaths per minute, and a normal rate is 12 to 18 breaths per minute, so that puts you in a normal range as well. And your pulse was 80 beats per minute, and a normal pulse is 60 to 100 beats per minute, so that also falls within a normal range. So to start today, I'm going to start by assessing your face. That's probably a good idea. Okay, so I'm going to start by palpating your face in 1 centimeter increments to assess for subcutaneous fat loss and muscle wasting. So to begin, we will palpate for temporal muscle wasting. I'm going to palpate your orbital fat pads and the cheekbone area, and what I'm looking for is bone protrudence. All right, so I'm gonna have you close your eyes. And what I'm doing right now is I'm inspecting for dark circles, loose skin, and a prominent brow bone. Those would all be signs of malnutrition. You can open your eyes. I'm going to inspect your chin. And what I'm looking for right here is protruding neck or sunkenness under your chin. I'm gonna look in your eyes. I'm inspecting for yellowing, which would be a sign of jaundice. Will you stick out your tongue, lift it and say ah? What I'm doing right now is I'm inspecting your tongue, you can stop, and gums for abnormalities. I'm looking at your teeth to see if any are broken or if you have dentures. Will you please roll down your lips? Good, and do the upper. Great, and what I'm assessing for right now is buccal mucosa in the back. I'm assessing your gingiva or your gums, and I looked at the floor of your mouth and the palate or the roof of your mouth and your tongue. Everything looked good. I would be assessing for tongue abnormalities such as smoothness of the tongue or roughness, but everything appears normal. All right, so next what we're gonna do is I wanna do a dysphagia screen. What we're gonna do for the dysphagia screen is I'm gonna hand you this glass of water, and I'm going to assess for swallowing difficulties and signs of aspiration. So how we're gonna do this is you are gonna take tiny swallows from this 3-ounce glass of water. I will place my hand on your throat for part of the swallows just to assess a normal swallowing mechanism. And then afterwards, I'm gonna ask you to say hello so I can hear your voice and listen for clarity. So we'll start with this. Just keep taking tiny sips. Okay. And keep going. Okay. Now please say hello.
Hello.
Hello. Now how did that feel? Did you feel like you have any difficulty swallowing or any lingering water when you tried to talk?
No.
Okay, will you make a cough noise for me? All right, and everything feels clear?
Yeah.
Wonderful. All right. All right, from here, we're going to continue downward on our nutrition-focused physical exam. I'm going to first assess your clavicle, and how we're gonna do this is I'm going to identify your clavicle right here. I'm going to follow the bone out to the shoulder region this is the acromion region. And what I'm looking for here is a rounded deltoid, which yours appear to be rounded, so there are no signs of wasting or malnutrition there. Will you please lift your arm to a 90-degree angle? Actually, let's do this arm. And what I'm going to do is I'm going to pinch the tricep region. I'm looking for excess skin or signs of wasting, and I'm also going to assess your skin turgor. Okay. This is good. I see no excess skin, so everything remains healthy. I'm going to go down the arm to your hands, all while assessing, again, your skin color, the skin turgor, and looking for signs of excess skin. Everything appears normal. From here, we're going to assess your hand. So first, can you please make the OK sign? And what I'm going to do here is I'm going to assess the muscle at the bottom of the OK sign, and that appears substantial and there are no signs of wasting there. You can stop. I will now check your nail beds. I'm looking for signs of concavity or thinness or ridges, which could be signs of nutritional deficiencies, and everything looks well here. And now the last thing I want to do is, can you shake my hand? I'm assessing for your hand grip strength, and that seems substantial, and I see no signs of wasting there. Right now we're going to start with the back, and I'm going to start at your shoulder, and I'm going to assess the scapular bone region, and everything appears well here. And then if you can lift your arm again like this for me, I'm going to assess your mid-axillary line, your posterior axillary line, and your anterior axillary line. I'm also going to assess your iliac crest, which is right here, and then I'm going to feel your rib bones for signs of obvious protrusions. Okay, and then you can put your hand down. That all feels good. I feel no signs of bone protruding, so there should be no muscle wasting apparent there. From here, we are going to move on to your legs, which I will inspect and palpate. I'm going to put this up. If you could put your legs up right here. All right. So from here, we're going to start at your thigh and check for concavity in your thighs. I'm going to work down to the patellar region right here to assess for signs of protruding or muscle wasting. And from there, we will go down to your calf and check for thinness and muscle loss. Okay, no excess bone protruding here. I see no concavity in your thighs.
That's for sure.
And no muscle wasting or thinness in your calves. I'm also looking for, again, like we did with your arms, I'm assessing skin color, turgor, and signs of edema. Edema is often seen in the feet and ankles, and that would be swelling due to fluid. I see no signs of edema here.
Do you want me to my socks off?
Nope, that's okay. Okay. All right. From here, we're going to move on to a cranial nerve assessment. The first thing I'm going to assess is your trigeminal nerve. So clench your jaw. All right. From here, I'm going to move on and assess your facial nerve. What I'm looking for here are signs of symmetry on your face to make sure that everything is functioning correctly. So can you please smile, pucker your lips, and blow out? Perfect. That all appears symmetrical to me. I will assess your glossopharyngeal and your vagus nerves. So if you can please swallow and then say ah.
Ah.
I can see, while you do that, I can see, say ah again.
Ah.
Okay, so I can see that your uvula is in the midline and that your palate is rising, which is the desired result. To continue on, I'm going to assess your spinal accessory nerve. What I'm going to do is I'm going to set my hands on your shoulders, ask you to raise them, and then I will ask you to turn your head right and then turn your head left. So, set my hands here. Please raise your shoulders. Okay, you can lower them. Please turn your head left. Please turn your head right. Okay, everything appears normal there. I'm lastly going to assess your hypoglossal nerve. Please stick your tongue out and move it from side to side. Good. All right. So from here, I would like to do a pulmonary examination. And what I'm going to do is assess both your chest and your posterior chest, and I will be assessing for chest expansion. First, I will inspect, and then I will place my hand and feel for rising. So I'm going to please breathe in and out as you would normally. Okay. Great, and then let me go behind you. Right, and I will palpate and feel the rising. All right, everything appears normal here. From here, we're going to move on to a tactile thermitis exam. What I'm measuring in this exam is measuring air and density of tissue in lung. Abnormal density of tissue would result in unclear feelings of vibrations while we do this exam. So what I'm going to do is I will place my hands first at the top of your back. I will move my hands down, and as I move my hands down, please say 99, and then I will come to the front and we will do that again. Actually, if you could like turn face in so I have a little more access to your head. No, just like this so I can stand behind you. Okay? All right, so once you feel my hands, say 99, and as they move, say 99 with them.
99, 99, 99, 99, 99, 99, 99, 99.
All right, and then we'll do the front. Perfect, facing just like this.
99, 99, 99, 99, 99, 99, 99.
All right, the vibrations are strong, which means that your airflow and air movement is normal and that your lung tissue is properly dense. So the next thing we would do is do a cardiac assessment to assess your cardiac function. I'm going to identify a few places on you. I'm going to identify, and I would auscultate with a stethoscope, your second right interstitial space, your second left interstitial space, and then right here would be your left sternal border apex. And I would listen to these with a stethoscope and listen for normal cardiac beats, function, etc. All right, so that will conclude our exam. I assessed you for muscle wasting and malnutrition, and I found no obvious signs of muscle wasting, signs of nutrient deficiencies, and everything seems to be working properly.
Thank you.